given your clinical experience,
Yeah.
how many sessions are needed for EFT to improve clients' life quality or to solve the main clinical problems of the client?
Yeah, I mean, it just really depends on the client group, right? You know, and even with something like social anxiety, you know, we've got a protocol which is 16 to 20 sessions. And that seems to work for most clients, but some of our clients get done in 7 sessions or 12 sessions, and they're done, right? Other clients, it turns out they need more than 20 sessions, and then we have to figure out how to work with that, you know, because underneath the social anxiety is, you know, trauma, often deep trauma, and that trauma is what's driving the social anxiety, so you have to go work with that, and sometimes that's quite complicated. And particularly when the client comes in without good access to their inner world, so that they then need to spend some period of time in the therapy learning to develop that access, and that can take 10 or 15 sessions before a client can actually learn to move around in their internal world, get access, and then the therapy can start, right? So if you spend 10 or 15 sessions helping the client to learn how to focus, essentially, now then there's the social anxiety work with that, then we go to another level, get to the trauma work, you know, so it can easily take much longer, right? Just depends on the client group you're working with and the nature of that client's particular issues and problems.
Of course, yes, exactly.
Yeah, you know, so it's like asking how long is a piece of string. It depends upon, right?
Yes.
Yeah, right.
Besides depression, you have already talked on other populations.
Yes.
The effectiveness studies with other populations, are there relevant results? Do you want to talk a little bit about the results?
Yeah, I mean, certainly with depression, the therapy is highly effective. You know, I think we got a sense that it's in working with that critic process, a lot of what EFT's got in depression is really helping the person see the inner critic process and bring it out. And there's something very powerful about that. So we've got now a body of evidence. We're recognized as an evidence-based therapy by the American Psychological Association. Unfortunately, in the UK, the scientific review bodies are ignoring the evidence. They just kind of pretend it doesn't exist. But you know, certainly depression and post-trauma, as I said, there's a line of research, mostly by Pavio, but some by other people, and it does meet the criteria for being an evidence-based therapy if you use the American Psychological Association criteria. But that's not PTSD. That's people having difficulties with trauma, having been traumatized, right? And the couples, you know, Sue Johnson's group and Les Greenberg's done some research on couples therapy too. EFT for couples is a really, really effective therapy. It's got some of the best results of any therapy in the field. That's very powerful therapy. So those are the areas that EFT is strongest in. Yeah.
It's okay. It's clear. From the point of view of someone who believes in affective primacy, who believes that only emotions can change emotions, how do you understand or explain the so-called success of cognitive and behavioral focus techniques still dominant today?
Well, I mean, CBT folks are really good at marketing what they do, and they're really good at assimilating. You know, Aaron Beck once said that if it works, it's CBT. So, by definition, it must be CBT if it works, right? So, I mean, there's a process of sort of Borg-like assimilation, if I can make a Star Trek analogy. You know, so that's that. The other question is, how is it that clients in all kinds of therapies are able to use those therapies to change themselves? You know, regardless of whether those are behavior therapies or cognitive therapies or family systemic therapies or constructivist therapies or person-centered therapies or whatever. Clients in general, are able to use practically every kind of therapy to change themselves. And that's because...
Although the therapist.
Although the therapist. In spite of the therapist.
That's right, in spite of the therapist, right. Often in spite of the therapist. So that's because the client is the active change agent in the therapy. You know, like we, as therapists, like to believe that we're doing the heavy lifting, but actually it's our clients that are the active change agents, and we're there to facilitate their process. We're really there for them to use us to change themselves. But of course, we feel as though we're the center of the universe, because each person is the center of their own universe anyway. So if I'm a therapist, I'm going to feel like I'm the center of my universe. But the client is also the center of their universe too, and they're the person who's come to change. So anyway, so I think clients take whatever they're offered and they run it through their own processes. And I work with a team of researchers who were studying psychodynamic and cognitive therapy in the 1980s in the UK, David Shapiro's team. And no matter what the therapy was, if it was psychodynamic therapy, the clients would be trying cognitive therapy. If there's cognitive therapy, they're trying to look at their childhoods, and so the clients were doing their own thing, and they were just using what was offered to them in their own change process. So they're accessing their emotions. And they're using the emotions to change their cognitions, and they're using their emotions to change emotions, and they're following the action tendency to be.
Is there a common factor?
I think emotion is the common factor, right? Personally, but that's my view. Right?
Okay. So how do EFT copes with difficult clients, such as the severe personality issues, avoidant or borderline?
Yeah.
Is there room in EFT for this kind of problems?
Yes, I think so. I mean, there has to be room, and we make room for it. In the learning book, for example, we have a section where we talk about working with borderline processes. Because inevitably, as a therapist, you end up having to work with clients with borderline processes. Now, when you work with the sort of more difficult or fragile client processes, it takes more time, and you spend more time in the relationship, because there are more relational ruptures, and so relational rupture work becomes a more central part of the therapy. But relational rupture work is a task also, right? So it's a particular kind of task. Now, I do anti-chair and two-chair work with my clients with borderline processes, they can handle that. They don't have a problem with that. Clients with borderline processes are often so incredibly split within themselves already that the conflict splits just jump out at you, and the self-criticism splits.
Can they get in touch with their emotions?
Yeah, the issue with someone with a fragile or borderline process is not can they get in touch with their emotions, it's are they going to get overwhelmed by their emotions and go into a flooded, overwhelmed state? When they lose their emotion regulation. Right? That's the issue. That's what you have to be really careful with. And so when I work with borderline processes, I make sure early in the therapy that we work with a task called clearing space, which is an emotion regulation task. So I'm going to use more of a balance and now I'm using self-soothing. I think self-soothing is a really, really important task for working with clients with borderline processes. So basically it's the same things I was saying before. It's really important for us to work with these various client populations because, it's important for us to be able to meet these clients, and it stretches the therapy and helps it develop.
This leads us maybe to the therapeutic failures or in success in EFT, which are, in your opinion, the main reasons for an occasional therapeutic failure?
You mean when the therapy doesn't work, how do we understand why it didn't work? Well, in the book that, I think it's Watson, Greenberg, and Goldman, the 6 cases in emotion-focused therapy, they have 3 success cases and 3 less success cases. And basically their feeling is that the clients who were not as successful ran out of time. They didn't have enough. They need more therapy. The 16 to 20 sessions was too short for some of these folks. And I think a lot of it's the stuff I was saying before. If it takes 10 or 15 sessions for a client to develop a better relationship with their inner world and ability to look inside, then they're going to have trouble fitting into a 16 to 20 session treatment protocol. Yeah, I almost need, I think it was Rainer Sachse, a German person-centered therapist, who proposed that he's working with clients with psychosomatic difficulties or alexithymia. He proposed that you actually have a protocol for that. That's the first 15 sessions of therapy was about just teaching them focusing, essentially. And then you go on and do the work with the other problems. So that's a big thing. But also difficult life circumstances. You know, if the client's got, hostile others or is very socially isolated, I mean, if there's things in their life that are eating away at them, undermining their change process, undermining the things that might start to happen, then that makes it really difficult. We all know clients who have such difficult lives that all we can do is sort of accompany them and keep them from deteriorating, I think.
Is there an ideal client for EFT?
I mean, what's the Yavis client? Young, attractive, verbal, intelligent, successful, right? Yes? Right, you remember that, right? Yes, yes. I mean, folks like us, I don't know. Yes, so, I mean, there's clients that we find easier to work with.
More emotional conscious?
Yeah, I mean, more emotional intelligence, more. But of course, those clients need us less, right?
Yes.
I mean, a lot of those clients basically just need a little bit of, or they could do it themselves with a little bit of help or something, So, is there an ideal client? I'd like to say the ideal client is the one in front of me, right? Because every client's a challenge, and it's my job is to try to figure out how to help them help themselves, right? What it is going to be that's
the one that is there to be helped.
yeah, exactly. Yeah.